creating a stellar patient experience. Take a moment while I have you all here. Think back on the last 2 experiences you had at a recent medical appointment. That could be at a doctor's office, a dentist's office. Was it a great experience? Was it a bad one? Can you recall? Well, notice I didn't ask you if it was a terrible experience or if it was an excellent one. However, patient satisfaction studies demonstrate customers and patients will recall difficult, challenging, and terrible experience nearly 80% more of the time, while good experiences are not considered memorable at all. They're so unmemorable, they can't even be recalled. And a great experience is expected often, and often never shared. You can be going into a doctor's appointment, having a great experience, and never once will it come up in a conversation with your friends, your loved ones, or your neighbors. Humanizing care doesn't require a lot. It often doesn't even require software to do. It begins with the awareness that our power as the providers offering the care and our presence sets the tone. It often begins with protecting the agency that we work for and allowing a person-centered care overflow to the patients themselves. While I discuss how to have the best stellar care service you can give to a patient, the objectives today would be things like, how do we as medical providers can initiate that stellar experience while obtaining valuable information from our patients in order to develop a care plan to achieve the patient's overall wellness. So our objectives today: service quality, address pitfalls and manage service recovery. Number 2, recognize and be cognizant of non-clinical factors that influence patients' perceptions. Number 3, simple acts of kindness go a very long way. How to build a positive patient relationship. Quickly, let's go over disclosures. I have none. I do have history of working as a medical director of employee health and wellness for our hospital here in Yuma, Arizona since 2000. Medical director also for Laser Gals Medical Spa here in Yuma. And I did work in a chaplaincy program for our hospital here for a couple of years while I was in school, becoming a nurse practitioner. So let's get to the background of why we decided to do all this. I've had an opportunity to discuss and review Aspire's provider satisfaction and online ratings prior to completing my presentation. So I want to thank Golden for giving me the opportunity to look into it and see how well we're doing as a whole. These results demonstrated that Aspire as a whole has a rating score of 4.8 out of 5. That's over 500 review statistics that came in. And for that, I offer you all a big applause. That's well done. It's not an easy thing to do. While we look at that and say a 4.8 is amazing, is there any way to improve those scores? And I would say yes. Yes, there's ways that we can improve, not only for patient satisfaction, but also for provider satisfaction. I think we all get up in the morning trying to do our best, and when a patient describes an experience they had with us that wasn't what we wanted it to be, we reflect and go, could we have done it better? What did we miss? I thought we were doing well. So this is this opportunity to discuss and perhaps ways where we can improve that. Just understand that a patient's experience, whether good, bad, ugly, indifferent, reflects on the patient's perceptions. Oftentimes, those perceptions are gathered from years of having different experiences with either their own personal medical appointments experiences or with the family members. A provider has to understand that when a patient walks into the room and you get to say, good morning, good afternoon, my name is Ana Gutierrez, how can I help you? That patient brings in all those different experiences, memories, and their perceptions. It causes their engagement to be back offish. It causes their engagements to lean in, and it often causes those engagements to be rewarding on both sides. So let's talk about service quality. As a medical provider, the most important thing to understand is understanding that a patient's perception drives their satisfaction scores. We must be aware that the patient brings in with them all their past experiences, the good, the bad, and the ugly. Therefore, we must recognize in the patient's eyes our ability to communicate and to unpack these current past experiences forms a major component of the provider's competencies. This is according to Berman and Chaka. In turn, our effective communication can contribute significantly to improve the patient's experiences and outcomes and treatment compliances when we can engage in understanding where they're at. Being a good provider requires not only the knowledge and the technical skills that we have, but it also requires effective communication. We cannot make every patient happy. However, my motto is that I'm sure going to try. And I think that we all at Aspire want to try. In school, whether you graduated from a medical school, a nurse practitioner school, or a PA school, communication skills are not in our firm foundational studies. However, acknowledging we all can improve our verbal and nonverbal communication is our first step in reaching that goal of patient satisfaction. Before we discuss the pitfalls, it is essential to understand we are the leader in driving communication in the patient's experience. The patient places us in that role. Despite our ability to manage other non-clinical factors before they even get to have communication with us, they place us at the role of the leader. Although there can be many obstacles that can hinder that, let's discuss ways to address them. Again, what influences the patient's perceptions? In our field, symptoms and illnesses supersede the patient's identity. You can only imagine when someone walks into our office feeling ill, having a fever, sinus headache, sinus pressure, have had a runny nose for many, many months. The medical culture often exacerbates this issue, right? They're standing at the front desk, they're full of boogies, they need tissues, they don't feel well, they haven't felt well for a long time, but they want you to fix them now, like right now. Sometimes their family members come with them, and it's difficult to get the chief complaint right away because the family's telling you all about their symptoms. And what we're trying to do is be effective, and timing is everything. So you have to know your audience and state the tone. What do I mean by that? When we know the audience and we're able to set the tone, then we set the pace and hopefully get the information we need, let the patient explain what they need, and then often have an effective care plan in place. How do we do that? Well, the first thing is always introduce yourself. Every time we walk in through the patient's room, This restores identity. Hi, I'm Anna. I'm the nurse practitioner of Aspire Allergy. And you are? And who do you bring with you? Those kind of things just really demand attention. If we don't do that in a normal basis, I suggest you start sitting at eye level with your patient. Softens the power differentials that we're often taught to do. If you haven't done that part when you're meeting a patient, I often find that that is essential in building trust. For many years, I worked in the emergency room as a patient advocate. There were quite a few litigious cases that we were being brought to our administration at the hospital. They asked me to be the go-between the provider and the patients when I was studying to become a nurse practitioner. Years ago I did this, and listen, it was like the biggest educational treat I ever received, because I often was the buffer when a family member or family was not having great communication with the physicians in the emergency room. So you can only imagine that in the emergency room, there's lots going on. Very tragic cases, emergencies as one can imagine, not so many emergencies as one can imagine. However, their needs weren't being met because the communication was just not being met. So I often was able to go into the room, calm the situation down a bit, find the temperature, what was happening, and perhaps lend an opportunity to meet not only the patient's needs, but also what the provider was trying to tell the patient. I would sit bedside with the patient and the family member, discuss where the communication difficulties was happening, and then bring the physician or the provider back in and discuss on ways and how we can meet it. It wasn't a he was a bad guy, she was a bad guy, the patient was a bad guy. It was more on how do we all get on the same page to meet what the patient's needs are. I find if we set this priority in respecting the patient's basic human needs, fear, illness, miscommunication, we can often cut to the chase and get to the bottom factors. At Aspire, I've had one or two run-ins with patients where they came in expecting A, B, C to be done and not understanding why they expected that. But I would often discuss how we can get to what their needs were, but perhaps not do it at the A, B, C. Maybe it was A, 1, 2, 3, then B, 1, 2, 3, C, 1, 2, 3. But being able to get to where they wanted to go and perhaps given direction on how we needed to go was the best thing we could do at the beginning of the visit. I never underestimated a patient's knowledge, and at the same time, I try to communicate my knowledge and understanding where they're coming from. Why do I say it that way? You have to understand, when we put ourselves in the position of leaning in and listening to their needs, we give them a way to explain their illness to us, their desires, their expectation. That doesn't mean we're going to meet each and every one of them, but it gives them a feeling of trust and building a relationship that can offer them help. Ways to cut to the chase. So Stephen Covey wrote a book many years ago, The 7 Habits of a Highly Effective Person, or 7 Habits of a Highly Effective People. So one of the principles that he speaks of is seek first to understand, then to be understood. This is one of the 7 habits that offers a principle-centered approach to personal and professional effectiveness. focusing on the character and the ethics of a person. I can share with you my personal experience. I have used this principle not only in my professional life, but also in my personal life. Again, working in the emergency room, urgent cares, hospital list provider, and as a primary, I have noticed improved connection with patients and my loved ones when I first started applying this principle in my practice. When a patient is in an exam room waiting to see you and is upset because of other issues, like perhaps billing concerns, high co-pays nowadays, large deductibles, perhaps an interaction they had at the front desk because they were running late to their appointment and was being told that they might be canceled. Perhaps they're having family issues. Just getting to the appointment sometimes for patients is overwhelming for them. Feeling overwhelmed with their illness, as I shared before, having this chronic rhinitis issues, sinusitis issues over and over again, being told that another dose of prednisone should take away their issue. They bring all that in, and engaging the patient for 3 minutes demonstrates that you were able to offload all of those thoughts the patient has. Listen to their story. I just got into a car accident before I came in. Your front desk told me I owe them $500 and I don't have $500. I don't have high deductible to pay, but I want to do surgery, but I don't have the money to do it. Understanding that those are patients' perceptions that walk in with them. And sometimes we can help them, and there are often times we can't, but at least we're listening to them. And we're setting a tone when we listen to them. It doesn't require more than a 3-minute conversation. Sit eye level with the patient. Look and lean in when they're speaking with you. This is golden. Studies have proven over and over again, when you sit eye level with the patient, the engagement and the trust increases. Personal questions. Shake their hand when they walk in or when you walk in. High five them if you don't like to shake hands. Bump them. I bump kids all the time. They love giving me bumps. You choose. You be in your comfortable place, but welcome them into your space. Don't be afraid to tell them about yourself. Be transparent as much as you can. This will help build their trust. In Yuma, we have a small town. So when I moved here over 30 years ago, it was difficult to feel part of the town. So when I started engaging with patients, I would ask, what school do your kids go to? Where do you live? What church do you go to? Different things to help me engage into their desires, their likes, to help me find that common thread or that common ground. It's not a 5-hour conversation. It's not even a 5-minute conversation. It's a quick, hey, are you from Yuma? Where are you from? Tell me a little bit about yourself. Where do your kids go to school? Where I've been here now in Yuma for 30 years, so I often find one commonality between us and hopefully engage. And by the way, I write it down in my chart somewhere. Patient who is a winter visitor from New York City, where I was raised, or something of that matter. So then when I see the patient again, I can always go back. I've had a lot of patients over the years, as many of you have, and it's hard to remember everybody, but if you jot down something on their chart that recalls a commonality between you folks, it's super, super transparent. And the patient feels like they're important to you. Some patients won't engage. Be aware of that. They don't want to tell you their business, and that's okay, but at least you reached out and you leaned forward to try to do that. I had a great mentor in my chaplaincy life, and he shared this quote that I often use. And the quote is, conversation is like medicine to the soul. And being someone who believes in medicine, and I often believe having conversation for immunists can set the tone, this has been very useful in my career. So again, seek first to understand than to be understood. And when you have a chance, use it on your children. If you have high school children, you can use it on your loved ones. I'm a little hot-tempered Puerto Rican girl, and sometimes my brain goes to a conclusion before I pull in all of the facts. So I use this principle often, and it's brought me some really good opportunities to build friendships, build better relationship with my patients. And if I can't understand what the patient needs, and it also gets me to a place where we have to regroup and say, okay, I'm not getting what you need. Let's talk about this, because perhaps this is not where your needs would be met. And that's okay to have that conversation also, but at least you're being transparent. And the last portion of this stellar patient care is acts of kindness. You know, being kind doesn't cost as much. And nowadays, when the world is not being very kind to people, I feel doing this not only talks about the philosophy of Aspire, but of many of the providers that work in Aspire. I have seen acts of kindness over the last 4 years that I've worked here, down to what they do for their patients, but what we offer each other. If you have concerns for a patient that are non-clinical issues, for instance, anything like a bill or anything that the front desk wasn't nice to them, or anything, the parking lot, they didn't like the way the parking lot was, just make sure that you share a name or a phone number that they can make the grievances to. I've worked with 2 VPs, both great VPs, Jennifer Duncan and now Michelle, and they've been wonderful in these aspects, in the sense that when I know a patient is having these grievances and really want somebody to hear them, when I share it with them, they often take care of them, and that just releases all of that extra pressure that you're feeling that has nothing to do with the clinical experience, but it's part of the patient's perception and experience. So we have to work together to manage them. Acts of kindness for me are things like, we recently had an elderly woman pass away that has been given allergy shots since I started with allergy and asthma over 15 years ago. And so we sent out a card of condolences to her family, and then they called me and sent me a thank you, letting me know that was unexpected and so thoughtful of us to send her a card. I often congratulate high schoolers that are graduating from a local high school and heading over to college. Most rewarding experiences I recently had, one of my high schoolers who graduated from allergy shots a few years ago is now in medical school, and she wanted to come by and shadow me. That meant the world to me. She wants to be an allergist. How cool is that, right? It is amazing for me, all the holiday cards that we get from our families that come in and are part of immunotherapy. Again, that's just building that relationship in the community, and that means the world to me. I've been known to ask patients, because we have a lot of winter visitors when they go home to their home state, to send me a postcard while they're gone. And you might think that might be a little intrusive. However, they love showing off that their houses and their snow and all the green they get to see, because they're in here. Sorry, here in Yuma, we don't have that much green, but I love getting those postcards. Little small acts of kindness that doesn't cost much, maybe a little bit of time, but means the world. I'm very careful in making sure I'm honoring the patient's privacies, right? But also enjoy having that communication, those conversations, enjoying life together, right? Because that's what it's all about, enjoying it. Being part of some of these patients' weekly visits to come in and get injections. Come on, they see us sometimes more than they see their own family. So I just want to know you are impactful. Our staff is impactful to a lot of these patients. What we bring to them is not only the wellness in the allergy world, but sometimes it's the only conversations they have outside of their loved ones. So it's a bonding experience that you can make happen. I often share with my colleagues, I could be the best allergist nurse practitioner in the world. However, if I don't take the time to listen to patients, they won't remember me. They won't remember our names. They won't receive their best care. Perhaps they won't even achieve their wellness because they're not willing to trust what we say on how to take care of their allergies, what immunotherapy is about, what Exact is about, trusting on the sinus surgeries, how to best manage their symptoms. It's engaging in being trustworthy, that we're very knowledgeable in what we do, but also taking in where they're at, understanding our audience, if you will, and bringing both of those worlds together. I hope you go away remembering a few things out of this educational piece, but most important, I want you to remember you make the difference. You here at Aspire make the difference. Giving exceptional care, it's not just being knowledgeable of the pathophysiology of things, but it's also giving heart. And I hope you all have the understanding a little better of ways in doing that. Hope you all have a great afternoon.